Firstly, has the government there made the right call, do you think, to extend lockdown there for another 4 weeks with case numbers sitting at 22 new cases today and increasing and such high vaccination rates?
Well, look, as you can imagine, Ash, I'm a employee of that government, so I'm fully in support of what's been done there. But let's look at the what's driving decisions like that, and it really is where it's difficult to control COVID-19 when it gets into certain parts of the Australian community, and that's no different in Canberra as it is to Victoria and Sydney. And so what we're looking to do across the entire country is ensure that vaccination rates are high enough, and then take the restrictions off in a slow, steady and stepwise way. And I think you'll see broadly similar sort of policy decisions coming out of all of the affected jurisdictions in the coming weeks.
Well, looking at the numbers in New South Wales, we've seen the lowest case increase in a couple of weeks. Is it too early to you to suggest the curve is flattening there?
Look, I made a prediction a couple of weeks ago which turned out to be wrong, that hospitalisations would plateau, but I think what we are seeing is case numbers plateauing. I really do hope that this is the bending in the curve that we have been waiting for, and it is attributable to the vaccines. How many more days to work that out? Some commentators are saying at the moment that it's early enough to say that we're seeing a plateau in case numbers in New South Wales. Let's see how we go for the rest of the week, but certainly it would be very, very positive news. And soon after, within a few weeks, because that is the lag time between cases and hospitalisations, hopefully we start to see those hospitalised numbers, intensive care numbers coming down as well.
There's increasing pressure on the state government in New South Wales to reassess the need for curfews, to reassess some of the rules and regulations in hotspot areas. There's this argument that it's unfair for these communities not to have the same freedoms as other parts of Sydney. Do you have a lot of sympathy for those arguments at this point, or again, is it too soon to start looking at relaxing some of those rules?
I think I have deep sympathy for those arguments. I mean, this is incredibly difficult in those hotspot local government areas, and I think the most important thing as we look at these policies is have a look at the ones that are most evidence-based, keep those, and then the ones that are perhaps not as evidence-based, such as curfews, they're the ones that do need to be looked at. Similarly, although I have no problem with people going to the beach, people who are not near the beach need to be able to go to parks, need to be able to go to rivers, need to be able to go outdoors and enjoy themselves in appropriately socially distant ways. So I do think that there is an equity issue there that we need to examine.
Okay, well, while we're going around the grounds, let's look at Victoria. 445 new cases there, 316 mystery cases. How alarming is that to you?
I think Victoria is in a very similar situation to New South Wales. I think, again, we have to think about a group of Australians in our community who are very much forgotten Australians, people who work 2 or 3 jobs, who are in essential industries, who are highly mobile and who have a lot of caring requirements for extended family members. This is where COVID-19 is spreading, and certainly COVID-19 is within those members of our community. So the most important thing is targeted interventions, as we've seen in New South Wales, as we've seen in Victoria, interventions that are actually based within the community and led by the community to improve vaccination rates. That is effectively the only way out of these sort of outbreaks.
As we do see those rates increase, there's a lot of debate going on at the moment about vaccine passports. We heard Matt Canavan just earlier today saying this is something that's going to really divide Australians, that they're unnecessary. What are your thoughts on vaccine passports and just how crucial a part they will play as we do start to return to some form of normal life?
Well, like any policy, there's the left, there's the right, and then there's the middle. And I think there is a way to go forward through the middle with vaccine passports. And this is how you do it. You make them temporary. They're not going to be around forever. They're designed specifically to increase uptake rates, and they don't exclude full participation in society. There might be things that you can't go to without a vaccination passport, a big footy final, or a big cricket game, New Year's test at the SCG or something like that. That is an option, a luxury for many. It doesn't fully exclude people from society if they can't go, but it does give you an incentive to get yourself vaccinated. And I think that's the way to go with vaccine passports. And if we promote them in that sort of way, then I think that they could be potentially a very successful way to get that final icing on the cake. We're talking about potentially another 5-10% of people to get vaccinated, hopefully well in excess of 80%. And so anything more than 80% than we get is going to be a benefit for our healthcare system and reducing the burden on it.
Dr Coatsworth, I understand that in recent weeks you've been working in a Canberra COVID-19 ward. Can you give us a bit of an insight into that experience? Are you seeing a lot of regret from infected people over the decision not to get vaccinated? Is there much denial from people that they even have COVID, as some health workers have been reporting?
There was none of that when I was working. I think people were very grateful for the treatment they were receiving. I wanted to make it clear that the wards were amongst the cleanest that I've ever worked in Australia. When you have to pay close attention to infection prevention and control and get your processes right, you get these beautifully clean wards that are uncluttered, that are safe for healthcare workers and for patients. And that's the sort of thing that we need to replicate around all hospitals in Australia, particularly those hospitals that aren't suffering under the burden of COVID-19 at the moment, should be looking very carefully at what their COVID safety processes are, because undoubtedly Delta will arrive in Brisbane, it will arrive in Perth and Adelaide, and those hospitals need to be as ready as the ones are over here.
Just finally, Nick, as someone who knows what the pressure is like, standing up, delivering health updates regularly to a room full of journalists, what is your opinion on Gladys Berejiklian's decision to scale back those news conferences? Is this a dereliction of duty? Is it just the natural course of where things need to go? Do you have a strong opinion either way?
Well, I think premiers are entitled to do whatever they want, and they'll have their reasons for doing it. Obviously, the daily press conference was a habit commenced by a different premier in a different state and for different reasons. So I think that there's no shortage of accountability to be had, and it's not necessarily achieved by daily press conferences that are often, Ash, not asking the most insightful questions. I mean, there's only so many times that a premier can or should be asked about crowds on beaches or crowds in parks. Sometimes I think the daily press conferences lead to us missing the core issues, and having less frequent ones perhaps will focus the minds of some of the people doing the questioning at those press conferences.
Very diplomatic of you, Dr Nick Coatsworth. Appreciate you joining us with your expertise. Thank you so much.
Thank you.